OTC analgesics are among the most widely used non-prescription medications. However, many patients do not fully read product labels and are often unaware of the potential for adverse effects and drug interactions. Therefore, tremendous opportunity exists for pharmacists to support patients when they have questions about selecting and using OTC analgesics. To address this opportunity, APHA, with support from McNeil Consumer Healthcare, has developed a Pain Relief in Brief printable guide. This guide and an accompanying web resource outlines key information for pharmacists to consider when making OTC analgesic product recommendations. The web resource also includes an assessment tool that allows patients to self-report information about their pain complaint, medications, and health issues in preparation for a consultation with a pharmacist. Let's begin by reviewing the printable Pain Relief in Brief Guide, which is available for download at www.pharmacist.com/practice-tools. The multi-page guide presents an algorithm that aligns with the Joint Commission of Pharmacy Practitioners' pharmacist-patient care process. The first page of the guide helps pharmacists know what information to gather from the patient who is experiencing pain and has questions. Then the guide helps the pharmacist assess whether self-treatment with an OTC analgesic is appropriate. The second and third pages guide pharmacists as they develop a plan for recommending OTC analgesics depending on various factors. These factors may include the patient's contraindications or intolerances to OTC analgesics, whether the pain is likely to have a better response to a specific analgesic, what health conditions the patient has, allergies, and which other medications the patient is taking. The fourth page of the guide outlines the implementation of the patient care plan. When asked, the pharmacist recommends an appropriate product and dosage and provides patient education to support appropriate OTC analgesic use. The guide provides key information to include when educating patients, such as correct product usage and guidance for how to self-monitor, report, and seek additional medical advice if problems develop or pain persists. Finally, it is important for the pharmacist to provide the patient with follow-up instructions and criteria for when the patient should seek medical attention. Now, let's review the web resource. The landing page of the website prominently displays an option to navigate to Pharmacist Resources or Patient Self-Assessment section. To proceed to the Pharmacist section, users are required to affirm that they are pharmacists. The Patient Self-Assessment section of the web resource invites the user to complete a self-assessment to determine if self-treatment of their pain is appropriate. If users decide not to complete the self-assessment, they will be asked to select reasons they chose not to complete the self-assessment before exiting the site. If users decide to complete the self-assessment, they will be asked to respond to 3 separate questions. Self-assessment question 1 screens for clinical conditions that would indicate that consultation with a pharmacist or other healthcare professional is recommended before selecting an OTC analgesic. Information is collected about the pain complaint and medical history. Self-assessment question 2 screens for specific medical conditions that could affect the selection of OTC analgesic products. The web resource can capture this information for the patient to share with the pharmacist, but does not recommend specific products. The third and final self-assessment question screens for use of medications that may interact with OTC analgesics. Each listed medication class has an active hyperlink that, if selected, will provide examples of medications in each drug category. After completing the self-assessment tool, users will be advised that the pharmacist can use the responses to determine whether an OTC analgesic is appropriate and make a product recommendation. The web resource will not provide the user with any specific product recommendation or treatment advice. Users may save a copy of their self-assessment responses as a PDF file to share with the pharmacist. Results of the self-assessment cannot be electronically communicated, and no personal identifiable information is retained by the website. When users have either completed the self-assessment or choose to exit the site, they will be prompted to respond to 2 short survey questions that will provide valuable information for future enhancements to the web resource. Finally, the pharmacist section of the web resource provides supporting materials similar to the printable guide. These materials are available for viewing and use in any sequence to allow flexibility based on the pharmacist's needs. Pharmacists are encouraged to take the time to review both the printable guide and navigate the web resource to determine how to best integrate these materials into their individual practice. Some suggestions include: train pharmacy support staff to assist patients with completing the self-assessment, save their responses to a PDF file, and then have the patient talk to the pharmacist. Ask patients who request assistance with the selection of an OTC pain reliever to complete the self-assessment using either a pharmacy device or the patient's device. Instruct the patient to save the results as a PDF and refer the patient to the pharmacist to confirm assessment results and advise the patient. Train pharmacy technicians and clerks to suggest that patients complete the self-assessment when they inquire about or purchase OTC pain relievers. Use the web resource as a teaching and training tool for student pharmacists. APHA hopes this informational video has been helpful and that you will utilize the Pain Relief in Brief resources described. To provide feedback to APHA, please indicate which of the following statements best represents your intent. If you are willing to be contacted in 3 to 4 months to complete a follow-up survey, please provide your email address here. Thank you for viewing this video. Please contact APHA if you have any additional questions or requests.